What is happening, people? Dr. Z here, and today is a little bit of a comeback. Um, I was doing all these episodes, and then all of a sudden, what happened is that what had happened was that um, I actually was holding an event up in Canada, and the whole week kind of took a hold of me, and and that's what kind of got us here. And so when I was involved with that event, the whole week, it took a lot of energy, and then I stopped doing my daily podcast. And so, but I'm back. And so this is episode number 134, and today we're going to be talking about diabetes and the differences between um, diabetes type 1 and diabetes type 2. And so, if you have diabetes, or if you have a loved one that has diabetes, or if you're a provider that wants to learn more about diabetes, this is the one episode that you definitely want to check out. And I'm going to do a lot more series on diabetes. And so, what's the difference between type 1 and type 2 diabetes? Well, you see, type 1 diabetes is, if you think of the body as a factory, type 1 diabetes is where something is not made, and type 2 diabetes is where something gets old and doesn't function properly. So, I'll go more in detail about this. So, type 1 diabetes is when you actually cannot make the key ingredient that allows your body to deal with sugar. So I explain myself. So for instance, if you think about the sugar and then our body as a car, then think about insulin as the key that allows the sugar to get into the different organs or the different parts of the car or the motors, let's say, to be able to be used for fuel. So um, So what happens is that if the insulin is not made, then the sugar is not able to be used, and therefore you end up with a bunch of sugar everywhere, right? And so then type 2 diabetes is where the key is there to allow the sugar to go into the different parts of the car, but the key doesn't work, it's worn out. And so we keep using the key, but it's worn out. And so what happens is that what 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 people with type 1 diabetes need is actually insulin, the replacement of that key, right, to use the sugar. Now, I've seen few people in my whole career actually treat themselves through dietary approaches with type 1 diabetes. This takes an incredible amount of discipline in the person's mindset, and also a lot of knowledge. Like this person who did this, it took him like 8 years to be able to figure it out, where to get their sources of calories, to be able to override the whole body system of sugar. I've never seen anybody else do it, but I've seen it a couple of times, mainly one person. And then the second part was type 2 diabetes, is where you have the key, but it's actually not so being overused. And so you try to put the sugar into the different parts of the car, but it doesn't work, right? Because the key is worn out. And that's most of the diabetes that we have around the world today. And so that's type 1 and type 2 diabetes. So the treatment for type 1 diabetes is to actually do insulin, and then the treatment for type 2 diabetes, this is where I'm going to talk about. So now the second difference that I'm going to talk about is the difference between getting rid of sugar and hiding sugar. Getting rid of sugar means that you're actually going to relieve the sugar outside from your body out, right? But what insulin does, and so most type 2 diabetics, when they take insulin, they think that their sugar is gone. It's not gone, it's actually hidden in other parts of the body. So think about this. Think if you had a garbage in your house and you wanted to get rid of it, but instead of getting rid of it, you actually get more garbage, and you actually put it in different rooms, inside, underneath the bed, inside the closet, whatever it fits, right? So that's what insulin does. And so that's the biggest misconception. People think insulin gets rid of sugar. It doesn't. In type 2 diabetics, it just hides it in different places. So the difference between getting rid of it and actually using insulin to hide it is actually not putting a lot of sugar into your body, so that your body starts flipping and switching the way that it uses fuel sources. Now, the third difference that I want to talk to you about is the difference between curing type 2 diabetes and actually just hiding uh, or slowing down its effects. So to cure type 2 diabetes is actually pretty amazing. I want to tell you a story. One time I was reviewing a film with a radiologist down in the hospital, and I talked to the radiologist, and I said, yeah, this patient is like this and like that, and the patient actually has type 2 diabetes, but he's actually gotten rid of their type 2 diabetes. They reversed it through diet. And he looked at me like he was confused, like, what do you mean he can reverse type 2 diabetes? And in that moment, I understood that even a lot of healthcare practitioners don't understand that type 2 diabetes can be completely reversed. And for this, I'll give you an example. So there was a study done in Ireland, and they found that 86% of the patients that lost 15 kilograms of weight, they actually had a complete remission of their type 2 diabetes, which is amazing, right? And so we know after that study, they say that their conclusion was that for a provider to actually shoot for the moon for um, and shoot for actually saying, that type 2 diabetes could be completely reversed is actually attainable goal, and it's actually very appropriate. And so that's what they were trying to get at. Um, so that's it for today. Today we reviewed the difference between type 1 and type 2 diabetes, the difference between curing type 1 and type 2 diabetes, and the difference between getting rid of the sugar or hiding it. And so that's the three things. Zulu time here. I hope that you guys have an outstanding day, and remember, take it easy.